thanks so much, Mo, and doing the best that we can, to ensure that we are supporting our families, supporting our students, and supporting our community to reopening our schools in the most best and healthy way as we move forward. So I want to thank you all for joining us this evening. I want to thank Tara Corralo, my chief of staff, and our director of community relations and public relations for helping to organize this effort with the folks from Holy Name Hospital. Tonight we have the opportunity to welcome four folks in the medical profession who have various different perspectives relative to this vaccination rollout and what we've experienced in our community. I want to also just mention that tonight's event is being recorded. I know we have other events happening in the district, and so this will be shared with other families who can view this after tonight to be able to receive information. I will also say for the participants who are joining us now, thank you for coming. But please ask your questions. We are not going to talk much. The folks on the screen, our hope is to answer questions, provide information for you. And so you have the option this evening of typing your question to the chat or at the appropriate time, raising your hand and being able to ask your question. We ask folks if you are going to verbally share your question to keep your questions under 2 minutes, just so we can keep the flow moving. But we want to provide as much information to parents as possible, specifically around the vaccinations for students and even for yourself. If maybe you're on the fence and trying to figure out whether or not you want to be vaccinated. I will tell you, I have gone through the process. I received my second shot last week. I had to wait the 60 days because unfortunately I contracted COVID, during Christmas of all times. Ho, ho, ho. And so, I jumped at the first opportunity to be able to, get the vaccine, as we have moved forward. And so what I'd like to do tonight or now is introduce our medical professionals who joined us this evening. First, I want to introduce Dr. Barry Banchik. Dr. Banchik, welcome. Dr. Banchik is an experienced and respected pediatrician. Dr. Banchik is a board certified by the American Board of Pediatrics. He received his medical degree from the University of Guadalajara. And also Dr. Banchik completed his internship at Brookdale Hospital. Dr. Banchik, welcome. Thank you so much for joining us.
Thank you. Thank you.
Good to have you here. Next up, we have Dr. Sager. Dr. Sager is an expert in the diagnosis and the treatment of full spectrum of infectious diseases. So it seems like you've been dealing with this, probably from its inception. The good doctor has also been on staff at Holy Name Medical Center since 2007. With an office in Inglewood. He's also an adjunct clinical associate professor at Touro College of Medicine in New York City. Dr. Sager, welcome, and thank you so much for joining us.
Thanks for having me. I appreciate the opportunity.
Good to see you. Thank you so much. We also have Dr. Krissa Funes, who is a pharmacist and has completed her Bachelor's of Arts in Biochemistry at Drew University and a Doctor of Pharmacy from Temple University. Temple, big fan. All right. She also went on to complete a residency at the VA Caribbean Healthcare Medical System in San Juan, Puerto Rico. She's a board certified pharmacist and certified immunizer. Dr. Funes, welcome. Thank you so much for joining us.
Thank you for having me.
And lastly, to round out, we have Dr. Genevieve Coempley.
Yes, that's it.
Did I get it?
Yes, that's it. You did it.
Thank you. The worst is when you butcher someone's name and they're like right in front of you. So Dr. Coempley is a clinical pharmacy manager at Holy Name Medical Center. She received her doctorate of pharmacy degree with honors from the University of Illinois in Chicago. She's a board certified oncology pharmacist with over 22 years of experience. Doctor, welcome. Thank you so much for being here.
Thank you for having us.
So I have additional talking points that I must make sure I get through before any of my staff gets mad at me. Just so you all know the protocol for this evening, we are going to open the floor for the doctors to briefly just share their experiences and thoughts relative to vaccinations, specifically around those ages 12 to 18 and particularly. After each doctor will speak for about 2 or 3 minutes, we will then turn it over to our members of our community who've joined us this evening. And again, we would ask that if you have a question, you can either type it into the chat. We read the question. The doctors, you can take your time amongst yourselves to share your responses and your thoughts with regard to that, or you can raise your hand and Muhammad Saleh will bring you into our meeting and you'll have a chance to ask the question as well. We also have a frequently asked questions form that has been produced in English and in Spanish. And we also have, one of our doctors here who's able to translate in Spanish if need be as well. So we are trying our best to be as accommodating as we can. And so we welcome all people, to join us in this conversation this evening. So I'm just going to go in order of the folks who I see in my screen. And so Dr. Sager, if you don't mind, can you just share just kind of your thoughts, reflections with regard to the vaccine rollout and any thoughts, recommendations, suggestions you have for families?
Sure. So if I summarize, just remember I'm coming from the perspective of a infectious disease physician. So it's what I do for a living. And Holy Name Medical Center, as many of you know, was the epicenter of the pandemic in Northern New Jersey, Northeast. So we have incredible amounts of clinical experience. And so it's very fulfilling to see the vaccine culmination really of many years of science come to fruition. So I'll simply say, just as an intro, and I tell all my patients this, if you look at all the lives saved by every modern medical advancement, whether it's heart transplants, bypass, chemotherapy, et cetera, it still wouldn't equal all the lives saved by vaccination. So, we're talking about vaccines really here today, not so much COVID-19, but COVID-19 vaccines. Just keep in mind that it is truly the most powerful invention in modern medicine. It has saved more lives than all other medical modalities put together. So I look forward to, with my colleagues discussing and answering questions. I would just simply say, just keep that in perspective. And I understand that there's a lot of concerns and questions, but we hope to alleviate them this evening.
Doctor, thank you so much. We'll go to Dr. Benchik next. Dr. Benchik?
Hi. As you know, I'm a pediatrician and Suraj is the guy who knows all this stuff in and out, the new modalities that have come about. But as he said, the number one cause of the extension of one's life can be pointed towards vaccinations. And there has always been a question about whether a vaccine is going to have a side effect or not. But with the advent of the internet, people are making up stories that, this is going to cause infertility and things like that. And I think we have to get it to our people that are listening that there is no proof of that. Yes, there is no proof that it doesn't happen, but if you understand the science, which it took me months to finally learn, the science is there. This is a new technology. We're no longer taking bacteria and viruses and killing them or making them. We're actually putting something in your body which really should not do any harm. And I believe that the teenagers and children should be part of the vaccinating population.
Doctor, thank you so much. We'll go to our pharmacists, folks who I'm sure have been involved in helping to, administer the vaccine. Dr. Funes will go to you first, and then Dr. Kwempley will go to you second, okay?
Sure. So I wanted to share two things, and one is why I chose to get vaccinated, and the other is my involvement with the vaccination efforts. So I'll start there. We actually started our vaccination efforts in December, and I've been involved at the beginning developing patient education materials and education materials for all of our staff. So I'm always reading up on data that's coming out, and obviously with this being a new vaccine, new data is coming out weekly, daily, hourly sometimes, right? Things happen really quickly, but yeah, that's been my experience. And also as a vaccinator, I've vaccinated teenagers, I've vaccinated, 90-year-olds, and I get to see them at their second dose and they get to tell me how their experience was with their first dose. So overall, everyone says, yeah, it can be a little uncomfortable sometimes, the symptoms that you might get after your first and second dose. But as someone that did have COVID in March of 2020, I can tell you that the symptoms for me, in my case, did not compare to actually being sick. And then additionally, why I chose to get vaccinated, all of my family got sick in March of 2020, and it was a very scary time. And we didn't want to deal with uncertainty. We wanted to get this vaccine that has been proven to save lives and not risk getting sick again. So that was really our main objective with getting vaccinated.
Thank you so much. Dr. Kempley?
Yeah, so I'll also add and echo what Chrisia said. We were privileged, and I say privileged because we saw people coming in fearful about contracting COVID and seeing the relief of getting a vaccine that will allow us to take off masks and allow us to think about life before 2020 when it all went down. I got a chance to work with our team from the moment the vaccine was approved. It was actually a day of a snowstorm. And I remember I live an hour away from Holy Name, slept overnight because I knew the vaccines were coming. We were ready for it. And as soon as it happened, we made sure it got into arms. And I can tell you over hundreds of thousands of people that we've seen gotten vaccinated, that has been the passion. And anything and everything that we could do, we've been doing. And so as a parent of 3 children, 22-year-old, a special needs individual, and a young child, I've seen all my kids get vaccinated. And even the special needs ones was, I have a son who was diagnosed with autism, and which was a population that in itself became a challenge to say, how do we do this? And it is one of those areas that you come as a parent and you look full force and said, I don't want to go back to the days of seeing my loved ones, fearful and ready to, lose it. So I, from a pharmacist perspective, like Chrisia, from a personal perspective, just wanted to put it out there that, this is something that we needed to do. And we're here to talk to you all about it and be real. And I hope that we can be real tonight.
Thank you all so much. So I just got checked by our technology person. We'll be using the question and answer feature that is built into the Zoom for this evening, not the chat. I apologize for that. So at this point in time, we'd like to open up the floor to the members of our community who joined us. And so if you have a question, please populate that in the Q&A box, or just simply raise your hand and we'll pull you into the meeting, either one. But we certainly want to begin by hearing from parents and our students in reference to the questions you may have. And I want to be clear, no question is a silly question. I want to be clear about that. I asked tons of questions to our physicians in district when the vaccine came out because I have a doctorate in education, not in medicine, and there was so much that I didn't understand relative to the vaccine, so much I didn't understand relative to its rollout. What was the difference between Pfizer, Moderna, Johnson & Johnson? Why one had to be cold and one had to be colder, one had to be coldest. Again, for a layperson, these were things that I just couldn't grasp my head around. And getting those answers absolutely helped me and alleviated that for me. So so we'll go to our first question. We have a question from Carmen. And Carmen's question is, hearing young people are experiencing heart-related issues. Can you talk more about that as it relates to 12-year-olds and probably young people at that? Carmen, thank you for asking that question. The question again is, hearing young people are experiencing heart-related issues. Can you talk more about that as it relates to 12-year-olds? And I would assume the effect or not effect that vaccines may have on that. Phil?
You'd like me to take that question, or who would you like to start?
Let's start with you, Dr. Slugger. Start with you and Dr. Benchek, and then we'll move on to our trusted pharmacist as well.
Sure. So it's a good question. The term for that is myocarditis. That's the inflammation of the heart, I think. And Dr. Benchek alluded to it earlier. This is the first pandemic in the social media era. So people obviously hear the worst case scenario and they run with it. And so I just want to kind of echo what he said was you always want to trust your source of knowledge, because just like we're having a COVID pandemic, we also have a pandemic of misinformation out there. However, this is a very good question. And what I would say, this is extremely rare. Myocarditis is an inflammation of the heart. And we have to understand that while no vaccine is 100% effective, we know that COVID-19 vaccine is extremely effective. In fact, much more effective than even our seasonal influenza. So that's one factor. Second is that yes, vaccines are extremely safe and efficacious, but if you're giving it to tens of millions and hundreds of millions of people, you're always going to have outliers of either side effects or associations, and it still has to be determined. So, myocarditis happens. If you look at billions of people around the world, it happens. And what we have to see is, is it happening any more in people who are vaccinated, non-vaccinated? And that is what we're looking at right now. So it is not definitively linked. You can have a cause and effect type relationship, or you can have association. I may get a vaccine and fall down because I'm clumsy. It doesn't mean that the vaccine caused me to fall down. And any given day, X amount of people may fall down because they're clumsy or because they trip. So you understand it's a silly analogy, but it's the real thing. So people shouldn't focus so much on these very rare events that happen, because they're exceedingly rare. We're talking less than 1 in a million, and they happen even in people who don't have vaccinations. And so the exact nature of that relationship has not been established. I think what happens is that people kind of run with these very rare, extremely rare side effects or potential side effects, not even definitive side effects, but potential side effects, and they focus much more on that. Let's remember, COVID-19 can cause myocarditis. It causes inflammation in children. Dr. Benchik can allude to, talked about that, but there is a syndrome in children, while not overly common, not rare, where children develop inflammation throughout multiple organs in their body related to COVID. So we always have to look like the disease, again, overwhelmingly is worse than the cure. In this case, the cure being the vaccine. So again, myocarditis is what you're referring to in the question. It's exceedingly rare. And at this time, while we're looking at it, like we look at all potential side effects from a vaccine, the pharmacist here will talk about the Vaccine Adverse Effect Reporting Service, or VAERS, which we utilize, if someone has a rash after a vaccine. We look at this very closely, and that's the evidence-based medicine that we practice every day. But I would urge anyone out there not to fall victim or prey to focusing on the exceedingly rare occurrences that may happen and that may or may not have any association whatsoever directly with the vaccine.
Just to add one thing to that, total agreement. But
pediatrician, what's been your experience?
I haven't had any side effects except for one kid with a urticarial rash, but I'm not sure it was from that at all either, because it was a second shot. But the incidence of myocarditis in children, the great majority of them are never detected because no one's going to be going and getting an ultrasound. But because of all the craziness, children that come in with a little bit of chest pain and a slight cough, they're finding it. And the original thing seems to be it is not higher than the natural incidence would be in the general population. It's just being found because you say COVID, you get everything you want. You get the echo, you get the whole workup. So I think that we should really just wait for all the numbers to come out before we worry about it, and understand, as Siri said, that's we're expecting something, but this is something that we wouldn't have known about in most kids. That's the bottom line. We lost you.
Dr. Funes, Dr. Kempley, your thoughts relative to the vaccination component?
Yes. So one thing that we always are making sure is that we're reporting adverse events or adverse effects of vaccines. And the CDC has very good safety measures in place to make sure that those things are being reported, and also the actions are taking place. We all heard of when we had a pause of Johnson & Johnson because of the adverse effects that were happening there with clotting. So we have systems in place to pause if something is particularly concerning. And that hasn't been a decision that they've taken so far, because it's not something that they've decided that requires a pause. So I would say to everyone, this is the most reported vaccine as far as safety alerts have been reported on. So it's something that we're monitoring every day.
Thank you so much. Dr. Copley, any other thoughts regarding this?
No, I think it's been well said here. The reality is that because we are monitoring, therefore you are going to find something. And this has been the most hypervigilant we've been about any medication, any vaccine, because the whole world is involved. So naturally, it's expected to see that. And I think we always have to look at the risk and benefits. And we can't quite forget where we've been in the last year. And so, yeah, it's been well said. I think it's rare. I don't think it's something that one has to, you look at the risk and benefit. The benefit outweighs the risk completely.
I'm going to pose this next question to our two pharmacists. It says, after receiving the second shot, and this is coming from Diane F. Diane, thank you for your question. After receiving my second shot, I got swelling in my lymph nodes under my arm. Is this a side effect that I should expect for kids? Dr. Copley, Dr. Fuentes, your thoughts regarding this?
Well, the swelling, and obviously you have the immune system involved. And so naturally, this is one of the things that we monitor for and look out for. Most of the people that we've vaccinated, we've not seen that in. We just started seeing the young population, which I don't see that as common. And I think the doctors here can speak to that as well. But it is just one of those things that we know the body, immune system is manufacturing a defense mechanism, antibodies. That's one of the things that you might expect. It does not necessarily mean that it's anything bad. And that's the key point. On the flip side, I have people who also say, well, I didn't see anything happen. So does that mean that the vaccine worked? I didn't get sick, so did the vaccine work? So you see it in all manners, but I will honestly say that that's not something to be obviously concerned about unless it's accompanied by other symptoms. And so that, that would be my take on that. I don't know if Dr. Salga or Dr. Bensick has something else to add to that.
Thank you. Dr. Funes?
I would say, as with those symptoms, if you've had the symptoms, you know that they go away within a couple of days. Even the swelling goes away in a couple of days. So it's something that it's your body reacting to the vaccine, but that's all I had to add about that.
Got it.
And in a rare occasion, that someone who's given hundreds of thousands of vaccines in his life, kids hate me for life because of that. There is sometimes it may hit a muscular fiber and you'll have a sterile abscess in that area, which causes the swelling. It's not always the material that's put in there too. And adenopathy would be totally expected after your body's inflamed.
Wow, thank you, doctor. And for that point, Dr. Bensick, Dr. Slugger, I will, pose this next question to you. This comes from Carmen. She says, do you all have any concerns with regard to children with epilepsy? Great question. Taking the vaccine. Your thoughts, doctors?
Yeah, I would say the opposite. My concerns, now it depends, is the epilepsy isolated as a part of a genetic syndrome? But we know, for instance, trisomy 21 or Down syndrome, children on the autism spectrum, epilepsy associated with other genetic disorders or increased risk from COVID-19. Right, so that's what you have to look at. I would look at it the other way, saying that these are children who are increased risk for, we call severe sequelae from COVID-19, maybe more than just a cough and sneeze and stay away from home for a couple of days. So I would argue that those are children that are even more important to get vaccinated because we know associations, again, juvenile diabetes or type 1 diabetes, autism, trisomy 21, epilepsy or other genetic disorders, other immunosuppressive states, children with cancer, children on certain therapies called monoclonal antibodies are much higher risk for severe disease. So I would look at it that way. The only thing, of course, one would ask, is there any interaction with the AEDs, anti-epileptic drugs? And again, the great thing about this messenger RNA vaccine, again, those are the two vaccines, I think it's just fair mentioning, that are approved in children and adults, adults and children now. The J&J or Janssen is a different mechanism, it's an adenovirus vaccine. But the messenger RNA technology, which has been being worked on for generations, is really a culmination of many years of hard work. But the beautiful thing is, as Dr. Bensick mentioned earlier, we're not giving a inactivated virus or bacteria. We're not giving what we call attenuated. We are now giving instructions to the body to make just a little piece, what we call the spike protein of the vaccine, and make antibodies against it. And then it magically, it's almost like Harry Potter, just disappears, very quickly. And so there should be no major, what we call drug-drug interaction with children's medications and the vaccine. So that should be very reassuring to people out there. So we often get asked like, gee, this vaccine seemed to be hurried. And I would argue that no, this is a culmination of many years of hard work. And this messenger RNA is almost like we now have the hardware, and all we have to do is keep updating the software. So every year, if we need to give a update for new variants that are out there or give a booster, we can just update it very easily because we have this messenger RNA technology. But again, it doesn't interact with human tissue. It disappears very quickly. And so there should be no major effects with children's medications. But we have to understand if your child has certain conditions that I just mentioned, they're at increased risk for COVID complications, and even more important that they should receive the vaccine.
Dr. Vanchik, you're a pediatrician, and I'm sure you've had patients who are young people with epilepsy. What would be your advice to parents regarding this decision around getting vaccinated?
I would have no problem doing it. I mean, fortuitously, and what's changed in the world of pediatrics is most kids with epilepsy are not on medication. So I don't think medication is an issue. Most children have had a seizure because of fever. That is the most common cause of a non-chronic cause of epilepsy, which is in childhood. And, vaccines have been blamed for brain damage for centuries, and that was incorrect. So I would urge my patients that they take this medication, that there's not an increased chance of bringing on a seizure. It may give a fever, which if you're prone to febrile seizures, you could get, but it's not doing anything, in my systemically bad to the patient at all.
Thank you so much. This next question actually, I think is for me. So I'm going to read it just to make sure we're on the same page. Again, if any of the doctors want to chime in, feel free to do so. But this comes from, Jen, who says, I totally believe that the vaccine, she totally believes in giving the vaccine to her son. She said, I want him to feel safe and going to school and seeing his friends. He got his first vaccine shot on Sunday and did well. My concern is the second dose, as my husband and I have had bad side effects, high fevers, etc. Will children be excused from class the day if they do develop symptoms? Jen, thank you so much for asking this question. To be very honest with you, we have not thought through that process yet. We have done it with faculty. When teachers have taken their shots, we have given them a medical exemption for the day. I think hearing this now from you, I'm going to have a conversation with our assistant superintendents tomorrow just to make sure we put a very similar policy in place, almost the same way we do like a sick note, or for that matter, so that a child will receive an excused absence. And so thank you for bringing that up. Again, these are why these conversations are important, because we are always trying to think about everything and acknowledge that we don't think about everything and see everything from the vantage point. But I assure you, as of tomorrow, no later than Friday, you'll receive a communication from your principals, just giving further clarity of just what you all can expect. Just so you know, we will be administering vaccines in the district for students. The first dose will take place on Friday, June 4th, from 2 to 6 p.m. With the second dose 2.5-3 weeks later, June 25th, from 2 to 6 p.m. We'll share more information with your school building principals. But we did it on a Friday for the purposes of hopefully giving students the opportunity for Saturday and Sunday that if they need to recover. But if you choose to get the vaccine in your own time, we will make sure we accommodate our students for that matter. Folks, we're doing great. Please keep the questions coming. We really appreciate this. The next question, it probably can be for either set of doctors. It says, is there a better choice between the mRNA vaccines versus the traditional Johnson & Johnson for 12 to 15-year-olds? I don't think the Johnson & Johnson's approved yet, right? Did somebody just want to just clarify which vaccines are approved at this point in time for young adults and which ones are still awaiting?
So the Pfizer and Moderna are both messenger RNA vaccines. Pfizer initially was 16 and above, and Moderna 18 and above. And then just earlier this month, Pfizer was approved for 12 to 15-year-olds. It's expected that Moderna just released their data for 12 to 15-year-olds, or 12 to 17-year-olds, I should say, and they're going to apply for an EUA, expanded use authorization, by the FDA as early as next week. Usually it takes about a month for the FDA to give approval, and that's what we all expect them to do. So that means by June, you'll have a second choice. But again, those are both messenger RNA vaccines. The other vaccine available in the United States is Johnson Johnson. Janssen is their vaccine branch. That's a one-dose adenovirus vaccine that is not currently approved for children. So that question, it makes it easy. Right now, it's just Pfizer. Moderna would only be if you're 18 and above. And so I'm assuming we're talking about high school kids, really the 12 to 17-year-olds. It's just one choice that makes it easy.
Thank you so much. Appreciate that. So this is a great question. I'm gonna pose this to the pharmacist, because I'm sure you all hear this question a lot. The question is, and this comes from Shay. Thank you, so much for sharing that. Will there be a booster vaccine shots in the near future, or what are your opinions or thoughts on whether or not a booster will be needed? Dr. Kwempley, Dr. Fuentes, your thoughts? Because I'm sure people are asking that question.
I think it's a great question. And I think Dr. Sagar alluded to that earlier, that, we anticipate that this is something that's going to happen. I mean, we're still in the learning phases of this vaccination and even the COVID. So that's what we're expecting. When, how much of it, we don't know.
Dr. Fuentes, anything else on that? Pretty cut and dry.
Just like what was mentioned before, it's a vaccine that is very easy to update. So for us to get another dose in the future, if I had to bet, and I'm not a betting woman, but I would say probably. But yeah, if it comes to that, I know that now that we have the infrastructure in place, we've had all the education rollout, and we have a lot of certified vaccinators now. We are more than capable of doing that.
Thank you. I have a question that's simply from me, and so this is for my own edification. And again, I have no problem asking it, because I just wondered about it, because I recently just had my shot. Why is it after the vaccine, your arm hurts so much? I've had the flu shot. I've had other shots before. I remember getting mine, and it felt like someone kind of decked me really hard in my arm, for that matter. Why is it that this vaccine, and again, the needle is absolutely small, and so I was so amazed when I got the first vaccine shot. I'm looking at going, oh, there's no way. And I woke the next day, I'm like, holy moly, this is real. What was that experience about? Just so again, I'm sure no one else probably wants to ask this question, but I will. Because that for me was the only major side effect that I felt, from the vaccine.
Was your arm swollen, or was it just painful?
Just painful. Just painful.
I've given hundreds of thousands of shots in my life, and I'm not saying that you are just a little. I think people get nervous when they get shots. I've had big football players fall off my table, and crack their head. I had one girl wound up in the intensive care unit. But my point is, with some of the vaccines, like the HPV originally, the one syndrome that they had was the chronic arm pain syndrome. I mean, there is a little bit of a psychogenic component for the pain, I believe. If it's red and swollen, that's my opinion, but that's about it.
Thanks, Doc. Appreciate that. Dr. Funes, Dr. Kumpley, your thoughts?
Chrisia, you're the vaccinator. You can have that conversation.
So there's definitely a technique, component. You have to be sure that you're vaccinating in the correct area. You want to make sure you're using the right needle size for the right arm. So sometimes people don't choose the needle size between a thicker arm or a thinner arm. And then also, it is the liquid that's going into your body can be irritating at the site, which is something that, I recommend everyone, as soon as you get a vaccine, start moving that arm around. Just don't leave it just in one place. And that tends to offset a little bit of the symptoms that people get from painful arm. But yeah, there is something going into your body. So even if it's a very thin needle, it's something that can cause a little bit of irritation.
Appreciate that. Thank you for the help. Oh, Doc, you're going to say something?
Yeah, I mean, so it's really had nothing to do with the size of the needle. It really has to do with the body's immune response. Like all these side effects, whether it's lymph node, low-grade fever, headaches, body aches and pains, it's all reflection. Instead of saying I tell people, instead of thinking about it in side effects, we call this reactogenicity. It's really the body's response to the vaccine. And as Dr. Benchik alluded to earlier, and others had alluded to earlier, with the lymph node, it is the body's production of antibodies, so we call B cell immunity, as well as T cell immunity. And so if the vaccine is going in your arm, whether it's influenza or whether it's the COVID-19 vaccine, you're going to have a local inflammation reaction there. You're going to have all the soldiers in your immune system, the B cells producing antibodies, T cells, they produce things called macrophages and dendrites. And so that actually soreness has nothing to do with, hitting a blood vessel, has nothing to do with how large the needle is. It's really a reflection of the immediate area of inflammation. And as that spreads throughout your body, about 3 out of 10 people may, again, experience headaches, even chills, quote unquote flu-like symptoms, very mild, maybe about 3 to 6 hours on average that it lasts. But again, I tell patients that think about it that way. If you have symptoms, it's your body doing what it's supposed to be doing. And as was talked about earlier, if you don't have symptoms, then it's still doing what you're supposed to be doing. Everyone reacts a little bit differently to this vaccine.
Thank you so much. And thank you for answering my question. I figured, because I work out a lot, such a big guy, that maybe had something to do, with it.
It was the bicep curls you were doing. Maybe that was too much.
There you go. Appreciate it, Doc. Thank you so much. We're going to get back to our questions. And I want to thank Rita Yurovich. She's our head nurse in Teaneck. Rita just shared that if you're sick due to the vaccine and the parent notifies your school, that's recorded as an excused absence. I would just assume, make sure that, the school reaches out to the school nurse and you have that information. But Rita, what we'll do is we'll make sure we communicate that with all schools just to make sure everyone had that information. Thank you so much, Rita, for being such an integral part of our process in district. The next question comes from a parent named Olga, who asks, and I think this question is for me, are kids going to be required to have been vaccinated in order to attend in school in September? Honestly, what I'd like to ask is Dr. Sugar and Dr. Benchik to give your opinion on that. I will share with you at this point in time in Teaneck, there is not a requirement. We are following, the CDC guidelines, and the guidelines from the CDC, have not required schools to be able to do so. They have recommended that adults be vaccinated, at significant levels, which is why, again, in Teaneck, almost 80% of our staff, faculty and staff, have been vaccinated, and that was as of roughly about 3 or 4 weeks ago. I expect that number to get higher as the school year begins, but we will wait guidance from the state of New Jersey Department of Education and the Department of Health and the CDC relative to moving forward. But with that said, Dr. Benchik, Dr. Sugar, from that respect, what's your thoughts on that? Should schools be mandating vaccines for young people who are eligible to be able to do so?
I don't know what the legal ramifications of it are. We've always had it with the flu shot. It was mandatory up until 5, if I'm not mistaken, in the public school system, right?
Yep.
And then parents could opt out. As a person who's given vaccines his whole life, I've always had a fight with people that don't want to take vaccines. And I don't think anyone wants to be mandated to do it. You would know better than me, Dr. Sager. Didn't we this year have a flu mandatory in the hospital where you could lose your job?
Right, and that was actually very controversial and something that took many years to, myself and some of my colleagues, we can be blamed as the bad guys, in terms of requiring staff. But again, that's staff taking care of other sick people. I would just comment that this vaccine is a EUA, expanded use authorization, by the FDA and CDC. So right now, legally, they cannot require a vaccine that is not, quote unquote, approved. It's an EUA authorization, which means it's fast tracked and it's gone through all the checks and balances. It's really more of a regulatory issue. But I can't imagine, again, I'm not, from a legal point of view, I'm not a lawyer, obviously, but that from a federal point of view for public schools, that they can mandate this. Obviously, private schools can do whatever they want. And I'm sure Dr. Benchik would agree, though, that's irregardless. The idea is that we just want people to understand that even if it's not mandatory, of why we recommend it so highly and so emphatically and without reservation. That's what we're trying to do tonight. So the idea of making it mandatory is not what we're hoping, forcing people's hand. It's more just giving them all the proper information so they can make the best decision and then feel good about doing so.
Thank you. The next question I want to ask is actually to Dr. Benchik and Dr. Campley. The question from this parent, it said the person named HE, so I don't have your full name. But for you two, the question is, it's a really good question. Why would you give children the same amount of vaccine that you would give adults? Dr. Benchik, Dr. Campley, your thoughts on that?
You want to go first?
Yeah, sure. So every time a drug is approved, is studied, and they evaluated the dosing of it in children as much as they're doing in adults. In this instance, that's exactly what they did. And we're still learning about the efficacy or the effectiveness of the vaccine. And so at this time it was determined in the studies that this is the dosing that they want to use. And so in this instance, we can comfortably say, because we didn't see any more side effects from the medicine as we would in adults, we can now determine that it's safe. That's how I will answer that.
Thank you. Dr. Benchik?
I just know that in the younger age group, they're already trying 3 different dosages. Usually 12 is the cutoff for, over-the-counter medication or vaccines as between adults and children. But I know for the younger age groups, they always try, I believe, 100? And now for the adults, and they're going to do one for 50 and one for 25 on the younger age groups and see the benefits, as you just stated before.
Thank you so much. The next question comes from Denise Moreno, and this is a really awesome question. It's one, to be very honest with you, my girlfriend and I have had a conversation about, because we have, I think I shared with you, a 1-year-old. We're looking at hopefully having another child at some point in time, and she just got vaccinated. And so the question Denise shares is that SM-120 is the substance that is in most of the vaccines, which is suspected of causing cancer, damaging fertility, or an unborn child, and damage to the central nervous system, kidneys, respiratory system, et cetera. Can you please try to help clarify for us, do the benefits outweigh the risk? What are your thoughts and your feedback? And I'd actually like any of you to be able to kind of, share feedback on that, because that is a question, that is going around, especially amongst families who are looking to have children in the foreseeable future, or those who may have other, chronic conditions. Dr. Slugger, I'll start with you. Your thoughts on that? It's a great question.
This was started by a very vigorous social media campaign by a very large anti-vax group, claiming that the antibodies produced by the vaccine, so these antibodies are what the vaccine's inducing, and it's targeting the spike protein, so the halo around the virus that the virus uses to attach to the receptor called the ACE2 receptor. So there was a social media campaign saying that no, these antibodies will also attack the placenta. It will cause people to lose their pregnancy or not remain pregnant, not become pregnant, affect fertility, et cetera. And that was overwhelmingly discredited. However, that somehow has remained in people's psyche. And so what I will tell people is that there is absolutely no validity that these antibodies will cross into the placenta or somehow have an affinity for the placenta. The way these things work, it's like you can carpet bomb, if you're at war and we're at war against COVID, or you can have precision strikes. This is a precision strike. You're creating a bomb, or in this case, an antibody that only affects something foreign, only affects the viral particle. It doesn't affect anything in the body. There's no what we call cross reactivity. And so there's no validity to that. And the largest and most well-respected organization in the country in terms of fertility is the ACOG, American College of Obstetrics and Gynecology. And they emphatically, without reservation, recommend people who are pregnant, who may become pregnant, or who are what we call postpartum right after they deliver, to get vaccinated, because we know that pregnancy in of itself is a quote unquote immunosuppressed state. It's a lot of stress on a woman's body. And we oftentimes do see with influenza, women who are pregnant have untoward or unfortunate outcomes. We don't know the effect in utero. There is thoughts that COVID can affect, even if the mother's healthy, could cause miscarriages and other, unfortunate situations and lead to fetal demise. So I just want people to understand that this was a very vigorous social media campaign. The anti-vax community is extremely present on social media, and that there is absolutely no validity to any of this in terms of these antibodies having any reaction with the placenta or affecting fertility. Wow.
Thank you so much. We have a few other questions, and I think you hit that one out of the park, Doc. I'm going to go to Dr. Banchik next for this next question. Dr. Banchik, again, being a pediatrician, are there concerns with vaccines for children who have anaphylaxis reactions to particular allergies? Are there any components in the vaccine that can pose a risk to children with allergies or asthma?
Well, as far as I know, there's no egg. A lot of vaccines used to be made with egg, like flu used to be MMR. So we're not doing that now. Now, I believe there's ethylene glycol in so I think, if you have an allergic reaction to ethylene glycol, then you should not take it. Or if you've had anaphylaxis with it, probably stay away. But anyone that's really concerned about having an anaphylactic reaction to any component, even though they don't know it, they could just sit there for a half an hour or 20 minutes and go home. And everyone's prepared when we give the vaccine. We have EpiPens, right? IV, steroids are there. So I don't think that's a worry in my opinion.
Thank you. Any other doctors want to chime in on that?
Yeah. Go ahead, please. I think it's better to have the pharmacist answer. They know better.
No, that's fine. So for the vast majority of the people that we vaccinated, adults and children alike, have tolerated the vaccines very well. So, to Dr. Banchik's point of waiting, for people to 30 minutes, we've seen consistently, even the reactions we tended to see in the beginning were more of people who are anxious. The people who come in very anxious are more likely to have a reaction. And because we went through a period where in the beginning we were seeing it. And then we went through a whole series of people that we vaccinated and did not see any reaction. So I remember asking myself the question, what happened? I think over time we used to make a joke that we didn't turn green. We didn't grow extra appendages. And I think the rest of the people who were watching for us to do that now came in and realized that it was really benign. So yes, the reality is that if you have history of anaphylaxis or allergy, obviously we want to monitor those people closely. But for the most part, most people have tolerated this very well.
Thank you.
And to add to that, you can also choose to get vaccinated at the hospital if that's really like your concern that you're going to have an anaphylactic reaction, instead of getting vaccinated, at the larger centers or at an off clinic. You can get vaccinated in the hospital, and you can register directly there if you feel that you want to take every single precaution that you want to. So that's definitely an option in Holy Name.
That's a great suggestion. And Dr. Funes, while I'm on you, I will pose this to you and to the other pharmacists as well. And this is actually a really great question, just in regard to the kind of the time frame in between the durations in between vaccines. This comes from Shay as well. What's the rationale for the time in between Pfizer, which I believe is 3 weeks, Moderna 3 to 4 weeks, and the injections? Why the distance in time? And the two doses, and why the distance between time?
Yeah, so really it comes down to that's the way that they were studied. So they were given the 3 weeks apart versus 4 weeks apart. The guidance from the CDC is that, if anything were to happen between dose 1 and dose 2, you can even extend that period out up to 42 days if it's necessary, because you will still get benefit from that second dose of the vaccine. But it comes down to that's how they were studied.
Got it. Thank you. Dr. Crumpley, any thoughts on that one?
No, I mean, just as she said, the way the vaccines were designed in such a way that Moderna was 4 weeks apart, Pfizer was 3 weeks. While it is, what is prudent is to just make sure that you get the whole series completed. because we achieve maximum effectiveness when you do that. And I think that's the key point that we want to raise here.
Thank you so much. The next question comes from Jen, who asked a really great question. It's part me, but I'm also going to try to pivot and ask if some of the doctors can give me, their particular advice. And it's around, mask wearing indoors. As we know, the CDC has indicated that those individuals who are fully vaccinated do not need to wear masks indoors. But the question that Jen has asked is, if we can't mandate the vaccine, will the district, me as superintendent, mandate that masks should be worn coming into the fall? Jen, I would tell you at this point in time, we are following the guidance of our physicians and our doctors relative to their recommendations. I will tell you we have summer programs taking place in the district. Masks will be required for all in-person programs this summer. We will wait to see just where the guidance and the CDC is as we move forward and into the fall. It is possible that the mask mandate, could remain, depending on what the guidance and the direction of our physicians are. But I'll say, Dr. Sullinger and Dr. Banchik, what are your thoughts with regard to, thinking about schools and particularly in kids? Would you recommend that masks remain, or are we at a comfortable spot and point where we can start to take a step away from that? Your thoughts?
Yeah, so the idea of masks, they are highly protective. We know that, and highly effective. But we also know that they're not always comfortable. They can cause psychological trauma, especially to children. And so, it's not a long-term solution. The long-term solution is vaccines and driving down the rate and possibly achieving herd immunity. Now, the herd immunity is probably elusive, and that is a moving target based on the new variants that are circulating that are more infectious. So we can't really focus on that so much. So what I would say is that we look at what is the rate in our local community of COVID-19? What is our positivity rate? And what we had expected and what we are seeing now, even earlier, is that, by July 4th, things will go back to normal. I mean, now it's, only May 26th, and things are rapidly unraveling in terms of social distancing and mask wearing and heading back to normal. I think what we have to be concerned about and just understand for parents out there is that something similar happened last year, even without vaccines. And that's because people were doing more outdoor activities. The warmer weather is less conducive for viruses to transmit from person to person because the weather is warmer and more humid, and viruses are not stable in warmer weather. Droplets don't travel as far when it's humid. So what I want people to understand is that, things may rapidly return back to normal, and some people may say, well, forget it. Why do I need to get my kid vaccinated? I think we have to understand the fall and the winter, they may be at least regionally or sporadically resurgences of COVID and or influenza. We haven't talked about that, but influenza was very low this past year. And oftentimes we see when influenza is very low, the following year it can be very high. So we're still, concerned and in the back of our minds thinking of this twindemic, if you will, of COVID and influenza, which could be quite troublesome. So I think people should understand that, yes, while mask mandates are from the federal level are now receding, people should make the best decisions for themselves. And oftentimes it does come to individual circumstances, depending on person's own health issues. There may be local mandates that trump, higher up mandates. So you always have to look at the most local mandate. And people should also understand that we may have to, at some point, go back to wearing masks, especially if you're unvaccinated. So the idea of vaccinations protect everyone out there, including people who cannot get vaccinated for legitimate reasons. We also know that people do not get vaccinated for quote unquote selfish reasons. They don't want to. They don't feel it's important. I've never got the vaccine. I've never gotten sick. But it's a reflection of everyone else around you getting vaccinated. So you're protected if we all protect ourselves. But if rates go up, especially in the fall and winter, then we may have to revisit this mask issue once again.
I didn't hear it.
We have two more questions that we're going to take. Dr. Banchik, I'm going to give this next one to you because it's specifically directed towards a adolescent. Olga says that I have a 12-year-old son who just had the PVH vaccine about a week ago.
HPV.
HPV, got it. Should we wait a few days or weeks for him to get the COVID vaccine, or can he get it now? Great question.
it's a question that I had also, and there was a group meeting of a bunch of epidemiologists, and they say that they should not maybe be given at the same day, but there doesn't have to be a huge space in between the two.
Thank you.
Distance wise, as far as I'm aware.
Anyone else want to comment on that?
Yeah, CDC just updated the guidelines because a few weeks ago, to Christia's point earlier, when we're vaccinating an adult, they were recommending 2 weeks. Now they've updated their guidelines to say that you don't have to any longer.
That's what we've been doing with, well, we do that with kids too, so.
Yeah.
But it can change like anything else.
Oh, trust me, I know. The guidance changes every day. So here's the last question. Dr. Slugger, Dr. Banchek, I'll save this last two for you, and then we'll have some final comments from the four of you. The last question says, hello, my question is, I heard on the news about vaccine and some children having cardiac problems, like myocarditis or
Myocarditis.
Myocarditis.
Thank you. Again, not a physician. What do you think about this? And I think we talked about this earlier.
We did answer the question earlier, so I don't know if, since it's being recorded, maybe you want to do a different question, since that I think was answered in detail.
Just a little anecdotal thing. I have
It's our last question, so it's all good.
just about that question. And this is an interesting story. I had a patient of mine who supposedly had COVID, waited the 4 months, and then had chest pain, wound up, believe it or not, getting a cardiac catheterization. And they didn't find anything. But the rumor around town was that she had a heart attack. So it went from nothing to she had to get, an angiogram, which is unheard of in an adolescent usually. So a lot of false information is going on with this right now. And I think we covered the myocarditis before.
Right.
Thank you so much. All right, so we are going to finish up. I want to thank everyone for logging on tonight. This has been an amazing conversation. It has been recorded, and we are going to share this with members of our community. But I would ask all of our physicians, if you can, any parting words. We know Teaneck is a diverse community. Having many cultures and communities within our community, but our diversity is our strength. And so I'd be remiss if I didn't indicate that one of the reasons why we wanted to do this is to help break down that stigma, especially in communities of color, and particularly with regard to the vaccine, but also in other religious and faith-based communities, that may have questions or concerns relative to the science and how that may connect with our faith as well. And so these are really important conversations that we believe families need to have together. Dr. Slugger, your thoughts, Dr. Bansek, Dr. Funes, and Dr. Kwempley, any final thoughts as we conclude?
I'll just piggyback on what you said, is that the COVID-19 pandemic, certainly in all our eyes, has revealed disparities in healthcare access. There was a disproportionate effect upon the African American and Latinx community, especially, and for many reasons of which are completely legitimate. There has been issues in the past with distrust of medical services, distrust of vaccines, and we can talk a whole nother hour about that. But I'm very passionate about recognizing that and then trying to embrace that. So I just want to thank all the parents that are attending today, that for taking the time to become informed and be more informed and make the best decisions for their families. That's very fulfilling for us, that people are and we thank you very much for setting this up. But I think I would just say that Teaneck certainly is a very diverse community, and we saw how it disproportionately affected various communities. And so I think we will continue to do these type of outreach programs, but I would just encourage any parents out there to make sure you find trusted sources, talk to your physicians, any physician, pharmacist, nurse, healthcare provider. We're all very passionate about what we do, and a big part of it is education. So please, make sure you ask your questions, and so you can make the most informed decisions. And thank you for having us.
Wonderful, thank you. Dr. Benson?
I want to thank you for having me first, but if I have to give any advice to anybody about what they should do with their kid, I would just beg them, please, to know what site they're looking at when they're on the internet, when they get their information.
Wow.
People can post things and they're not true. So please don't just jump on the bandwagon and say, oh, I read that this can happen. That's happened with every vaccine that's come into practice in the past 40 years that I've been involved in. And this one in particular with the internet, there is a lot of misguided information out there.
Dr. Funes?
Yeah, so I can talk on being, Hispanic female in this time and being personally affected by COVID. My uncle actually passed away from COVID, so we are definitely a community that's being hit, that got hit really hard with this. And I know of a lot of, family members, like distant family members that also passed away. So this has been a very hard time for all of us. What I can say is, even when you're looking at headlines, on Facebook, people sharing articles, like read beyond the headlines, because just today I saw a headline from the New York Times that said, first patient in England to get vaccinated dies at whatever age. And the person had died out of natural causes. They had a history of stroke. So if you don't read beyond that headline, part of this is sensationalism. And I used to work in the Bronx with patients that, all they have access to is, Univision, Telemundo, all of that. And that is sensationalized. They say, come back at 11 and we'll tell you who died of XYZ, So you have to go beyond that and, do your homework, go to the CDC, go to respected websites, and that's where you should be getting your information from. And I'll say a little bit in Spanish too. No se crean todo lo que vean en Facebook, okay?
Es verdad.
It's clear. Thank you so much, Dr. Funes. Dr. Kempley, your final thoughts?
Yeah, so as an African-American woman and as a woman of faith, I'm a deacon in my church, recently had to do a talk for our church community. And one thing I said to the church community was this: we were praying hard for COVID to pass. God has answered our prayers and he has sent a relief. And yet we're asking, is this real? Of course it's real, because God answered your prayer. So I'm just talking out there for someone who's watching. It's like, well, I don't know about this, or, African Americans are experimented on and so on and so forth. But if that's the truth, I joked with one of my sisters in Christ in church. I said, well, why are all the white folks lining up first? And so if that was the truth, right? But I just needed to keep it real, to say, listen, we're all on this together. If people are lining up for something, there must be a reason why they're lining up for it, because it's good. And it is an answer to what we've been praying about. So for our church folks out there who are religionizing this whole thing, know that this is part of a solution that we've been praying for. As a mother with special needs, that's the other target group that I want to talk to. Please, 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 as you heard the doctor say tonight, the side effect for dealing with these issue of COVID in the special needs population is not something you want to play with. The vaccine can help to avoid a long-term effect from it. So that's one of the things that I want to encourage you. And then remember, every drug that we take has side effects. Every drug, even Tylenol does. So this is not any different. So we just want you to be well. And that's why we want to encourage you to do the vaccine.
And thank you all so much for being a part of this. Thank you all for being here today. As I shared before, as an individual who dealt with COVID myself, as a matter of fact, myself, my girlfriend and my son had it all at the same time within a month of each other. And it was not fun. And I would do anything to not have my baby boy have to be subjected to that, or his mom for that matter. And so I would implore, all of the family members and parents who are here, do your own research, speak to your physician, pray on it, and hopefully that will bring you to a decision of what you think is best. What we want to do tonight is provide information, and we hope this has helped. We hope this has helped advance the conversation around vaccines and teens. I want to thank our physicians. I want to thank our Board of Education for their support in making sure that we host this. I want to thank our staff, Mohammed Saleh, the Director of Technology, Tara Corrala, my Chief of Staff, for their wonderful work. And I wish you all a fond good evening. And please be safe. Thank you all very much. Take care.
Bye, everybody.
Bye.
Thank you, everyone.
Good night.